Hello all and welcome back to my YouTube channel. It's your favorite host, Hallie West. Today we are going to be talking about patient education. The first thing we're going to be talking about is gingivitis. Gingivitis is an early stage of gum disease caused by the buildup of plaque, a sticky film of bacteria on your teeth and gums. When plaque isn't removed by brushing and flossing, it irritates the gums, making them red, swollen, and likely to bleed when brushing and flossing. The good news is that gingivitis is reversible with proper at-home care. So first, when brushing, you want to brush twice a day using a soft bristled brush and the modified Bass method. When doing the modified Bass method, you want to angle the brush at a 45-degree angle toward the gum line using small circular motions. Using a fluoride toothpaste and considering one that contains antimicrobial ingredients will help tremendously. Flossing once a day to remove plaque in between the teeth where your toothbrush cannot reach. When flossing, you want to wrap it around your middle fingers and use your pointer fingers or your index fingers to maneuver the floss. Wrapping around and coming all the way back up. And doing that for every set. And for the hard to reach teeth in the back, if you're struggling, using one of these to get in between can really help. Using an antimicrobial mouthwash is very well recommended. Our next topic is periodontal disease. Periodontal disease, or periodontitis, is a more advanced stage of gum disease that bacteria and plaque causes the gums to pull away from the teeth, forming pockets that trap more bacteria. This leads to bone loss and connective tissue that supports the teeth. And if it is left untreated, it can result in tooth loss. So first, when brushing, we want to use a soft toothbrush using the modified Bass method. You want to angle the toothbrush toward the gum line and swoop down. Swooping away from your gums. Same with the flossing. We want to floss between all the teeth, getting back there, pointer fingers. For your interdental cleaning, these kind of look like little trees, a Christmas tree kind of. Looks a little funky. Just want to go and put this in between and give it a little massage to stimulate some massaging in the gums and to get in between. Our next one is advanced periodontitis or periodontal disease, and that's when we can see a bunch of the tooth showing, a bunch of the bone loose. When brushing with this method, you want to do the same method as regular periodontal disease, not advanced, just up higher in the gums. Since we have a lot more tooth showing, we need to really get up there. Our next topic is dental caries. Dental caries, or cavities, occur when bacteria and plaque produce acids that attack the tooth enamel. Frequent sugar intake and poor oral hygiene allow these acids to break down the enamel and dentin, causing decay. Brush at least twice a day using a fluoride toothpaste and the modified Bass technique. Angle the brush, small circular motions, or the brush and swoop. Floss daily to remove plaque in between the teeth where cavities often start. Same method, wrapping it around your middle fingers and using your pointer fingers or your to direct yourself. Use a fluoride mouth rinse or a prescription fluoride gel if it is recommended. Now, our next topic is a person with braces. Braces can create many areas where food and plaque can collect, increasing your risk for cavities, gingivitis, and decalcification. Keeping your teeth clean is very important during braces treatment. Brush after every meal using a soft bristled brush or orthodontic toothbrush using the Charters method, brushing above and below all your brackets. Doing this to all your brackets above and below. When you're flossing, use a floss threader or a super floss to clean in between your teeth and under your wires. So you're going to take one of these and tie the floss to it at the top. Then you're going to take this in between your brackets, thread it through, and now you can floss your teeth. The same method that I've taught you before, curling with your middle fingers and using your pointer fingers to direct yourself. Our final brushing topic is for our young ones, our kids. You're going to be using the Foams method. Big circular motion around all your teeth, making sure all your teeth are getting clean. Big circles. Now, we're moving into post-op care instructions. After a local anesthetic. After having a local anesthetic, avoid biting, chewing on your tongue, lip, cheek until all the numbness wears off. Usually it's about an hour, 2 hours after your appointment. Try not to eat any hot foods or drinks until your feeling in your mouth returns. Our next post-op is after an amalgam filling. Avoid chewing on that side for 24 hours to allow the filling to set completely. You might have some sensitivity to cold or pressure, anything like that. It's normal for the first couple days. Maintaining good brushing and flossing around your filling, and contact the office as soon as you have any sharp edges, cracking, anything wrong with your bite. Call the office immediately. Next is after a composite filling. The filling sets immediately, so you can try to eat after your numbness wears off, but you might have some sensitivity to hot or cold items for a few days, and that's fine. That's pretty normal. Avoid trying to bite on hard foods or sticky foods for like at least 24 hours until your filling is totally completely set, and maintain regular oral hygiene and check for any roughness, sharps, overbite, anything like that. Contact the office and we can change that up for you. The next one is after crown prep. You will be pretty sensitive. That's normal. Avoid sticky, hard foods for at least 24 hours. Brush super gentle around your crown and floss carefully. Flossing too hard might pop the crown right off. And if a temporary crown is placed, avoid chewing hard or sticky foods on that side. After a provisional crown or filling, avoid eating for 30 minutes to allow your temporary material to harden. Avoid sticky, chewy foods like gum, caramel, taffy, anything that can dislodge or take out your temporary. If the temporary does come off, call the office immediately to have it re-cemented. Brush gently and floss by sliding the floss out instead of pulling up. Slide the floss out, don't pull up. So that's it. That's everything you need to know for patient education and post-op education. If you have any questions, feel free to ask. Thank you.